Here we go, brand new edition of Sports Medicine Weekly on this Saturday morning. Hi, everybody. Steve Kashul, joined by my co-host, back again this week, Dr. Brian Cole, sports medicine specialist from Midwest Orthopedics at Rush, also head team physician with the Chicago Bulls and one of the team physicians with the Chicago White Sox. Doc Cole, how are you?
Steve, doing great.
Excellent.
Awesome to be here with you.
I want to thank Dr. Nick Verma for filling in the last 2 weeks.
Yeah.
And now you're back with us for a couple weeks in a row.
Nick always does a good job.
He does.
I listened to both those shows. It was you guys together are terrific.
Well, you do a great job as well. It's good to have you back in the chair. Doc, a lot to do in this show, but I want to start with this. This is a kind of a hot injury right now. USC, the Trojans, one of the biggest college football programs in the history of the NCAA, loses their sophomore quarterback, their starter, last week. JT Daniels missing the rest of the season after tearing the ACL and meniscus in his right knee during last Saturday's win against Fresno State. He'll undergo surgery in the next few weeks. So my question is, how frequently is the meniscus also affected with an ACL tear?
Steve, it's pretty common. And what's interesting, and I would say it's up to 2/3 or more have some type of meniscal tear, but it doesn't always affect the post-op rehab or the recovery. But the thing that's important for people to understand is that we try to say, well, there's an ACL injury. The time to get back is 6, 8, 12 months, whatever. That is just one component of it. So people have to be really sensitive to the fact that it's hard to draw conclusions from athlete to athlete because it's not just the ACL that's torn. In most instances, there can be a meniscal tear, and that can have an impact in terms of recovery. In fact, even if we repair these, it can lead to a situation where they can tear again. So we try to do our best to predict the likelihood of an athlete getting back, which, all things being equal, no matter what happens in association with an ACL tear, we do pretty well getting an athlete back, maybe 95% or better. But the length of time or the risk of re-injury and all those things do factor in. So that's why we have to be quite careful about just saying, well, so-and-so has an ACL tear, fix it, get him back in X amount of time, because it adds so much variability when the meniscus is involved.
Break that down. I know you're on radio here, but tell us ACL compared to what the meniscus is.
Yeah, so the ACL is a ligament, the anterior cruciate ligament. It's in the center of the knee, and it keeps the tibia, the shin bone, sort of attached to the femur or the thigh bone. And the meniscus is a C-shaped cartilage. So there's ligaments, right? That's the ACL. And then there's cartilage, which is the meniscus, and there's one on the inside and the outside.
Ligaments connect bones?
Ligaments connect bone to bone, and a meniscus is sort of like a gasket between the tibia and the femur that not only adds to stability, but also adds cushion, if you will, between the two bones. And when torn, can increase the risk of arthritis, can increase the risk of downstream problems, and change the post-op recovery. So the meniscus is cartilage, and the ACL is ligament, and they often occur together up to 2/3 or more of the time, and when managed properly, can return an athlete back to play, but does add quite a lot of variability to that return.